This is Healthcare Now Radio's Interviews Now. Thanks for joining us. I'm Roberta Mullin, today's host, joining you from Atlanta, Georgia. Follow our show's hashtag InterviewsNOW and join the conversation. In this fast-paced, ever-changing landscape we call healthcare delivery, who can we trust to tell us, good or bad, what's happening now? Let us help you sort out these issues with today's thought leaders in the know. On this episode, we'll be discussing healthcare systems, accreditations, and certifications with our guest, Lee Barrett. He's the Executive Director of EHNAC. That's the Electronic Healthcare Network Accreditation Commission, EHNAC. You can find them at ehnac.org. Hi, Lee. Thanks for joining me.
Roberta, always good to talk with you.
So Lee and I have been connecting for a few years now at the HIMSS conference. Some of our listeners might have heard the HIMSS highlights we've done. But before we start, I never get to talk to you about yourself, Lee. Instead of starting with EHNAC business, let's talk a little bit about you. Tell us about yourself and how actually did you end up in the health IT space?
Well, it's kind of interesting background and kind of journey, Roberta. So I actually started in healthcare when I was at Travelers. So I've got about 13 years of my career in the payer side. And so at Travelers, this was back in the 80s, Travelers was actually in healthcare, and they had their managed care employee benefits organization. So I was in the IT side of Travelers in healthcare, and what ended up happening is that how I really got engaged in a lot of the administrative simplification and a number of the health information technology issues that started is that Joe Brophy, who was then the president and CEO of what was called the Managed Care Employee Benefits Organization, which was the healthcare side, met with Barney Trosnowski, who was the president and CEO of Blue Cross Blue Shield Association in Washington, with then Health and Human Services Secretary Louis Sullivan. And they came back from that meeting, and they were actually charged by Dr. Sullivan with development of a administrative simplification report on the industry. And they were asked to do it in 6 months. So Joe Brophy came back from that meeting and called me into his office and said, Lee, I need you to work with an individual that Blue Cross Blue Shield Association is going to be designating, and I need you to develop and coordinate across the industry to develop this report in 6 months. So that's how we got I got very actively engaged, and we developed that report. We delivered it to the secretary, and then he wanted another report. Those reports really became the foundation for HIPAA legislation. And at that point as well, I also got involved and started X12N, the insurance subcommittee, and under the Accredited Standards Committee. And we started putting together and working very aggressively as well on developing all of the EDI transactions that were adopted under HIPAA as well in '96. So I got very actively engaged in a number of those, then went on and had worked at Aetna, went out, started my own consulting organization. I ran consulting organizations for about 10 years of my career. We started EHNAC in 1993. And I was doing that on a part-time basis until probably the past 7 years, in which I went full-time to actually run the organization there. So I've got a combination of large organizations, some of the consulting aspect. I worked and headed SAICs, healthcare, commercial payer healthcare business. I worked at PricewaterhouseCoopers. So I've got a variety of consulting, both large organization as well as a small organization, provider and payer. So it's provided me with a really excellent overall background. And then I chaired WEDI in 1999 and 2000. So I've stayed actively involved in a number of the different initiatives that have occurred in the industry. And EHNAC has continued to develop, and the need for third-party accreditation has even taken on a bigger role today than it did even a number of years ago. So I've been very fortunate, and that's kind of my background in healthcare.
Yeah, and there's a lot of policy in there, which is always interesting.
Oh, yeah.
Not everybody gets to be on that side. One of the things that when I was reading up on EHNAC recently, like last week, I didn't realize that it had started. You said 1993, and then it really became itself in 1995. That's like 22 years ago. I thought it was a much younger organization. Tell us a little bit about EHNAC, its background, how it became, why and where is the role it plays in healthcare.
So EHNAC, when it was formed, it was really formed under all those years ago under the auspices of an organization back then called the Association for Electronic Healthcare Transactions, or AFECT. AFECT at that time was the industry action group for the clearinghouses. And at that point, as you probably know, in that realm, 93 to 95, there were a lot of clearinghouses in the country. The concern on the part of the clearinghouses was that there could be a potential that they could be regulated as a result of any legislation that could evolve there. And so what they decided to do is to self-regulate, and so they put together about 100 different people from the organization. They spent a year working on developing criteria for an accreditation program for the clearinghouses, and then they spun that organization out, formed EHNAC, spun that organization out totally as an independent 501c6 non-for-profit, and I was recruited to run that organization as executive director. So that's how it was actually formed, and we started doing a number of accreditations with clearinghouse organizations that were part of the AFECT organization, and then it continued to grow. I would tell you that probably over the past 10 years, we've focused a lot of our efforts on the development of a variety of new programs and really the healthcare exchange side of the spectrum under health information technology. And so we've grown that one single accreditation program that we had for clearinghouses into 18 different accreditation programs that we now have. We're federally recognized as a standards development organization. We've got a 14-member commission representing various healthcare accreditation stakeholders that we have for all those 18 different accreditation programs. And the accreditation programs range everything from what is called our Healthcare Network Accreditation Program for electronic healthcare networks, EHNs, which is really the clearinghouses, to ACOs, to health information exchanges, e-prescribing. We're recognized and certified under the Drug Enforcement Agency, the DEA, for certification of e-prescribing for controlled substances. So those are the types of e-prescribing networks we also go through and certify. We have as well managed service organizations, practice management. We also we partnered a number of years ago with the Direct Trust organization and jointly created a suite of 3 different programs under what we're calling our Direct Trust Agent Accreditation Program umbrella, which includes health information service providers, or HISPs, certificate authorities, and registration authorities. So we're very focused, the organization has been very focused really on privacy, security, a review of an entity's technical and operational infrastructure, the best practices that they use, and the resources that they have to support. So it's a combination of a self-assessment, comprehensive self-assessment that organizations go through, and we have specific site reviewers that actually assess the organization in relation to all of their protected health information and where PHI is transmitted, exchanged, stored. We review all those sites. So it's a very comprehensive review. We've continued to enhance and revise all of our accreditation programs on an annual basis. So it's it's a very comprehensive framework, Roberta, that we use for really assessing an organization in relation to all of the aspects that I told you about, and we're really focused on risk mitigation management as well as preparedness planning and business continuity planning for organizations, as we've incorporated as well cybersecurity, ransomware, different provisions into our accreditation programs as well. So that's kind of the evolution of where we've come from over these 20 plus years, and we continue to evolve and develop additional programs, including, for example, we developed one over the past couple of years on focusing on data registries, which is now a big area in relation to whether it's immunization or provider directories, other types of directories that organizations are using in relation to support of MIPS and MACRA under Medicare for incentive payments, et cetera. So, and again, a lot of these registries are containing PHI in a lot of sensitive data, and so we're all about really securing and assuring reliability of that data as far as the exchange and assuring that the authentication between the various points, whether that as well that exchange is encrypted. And so as technology, health information technology has continued to evolve, the whole aspect of interoperability as well, we continue to enhance our framework to assure that we're taking into consideration the latest as far as technology advancements, enhancements, various types of best practices that we also want to be looking to try to help to move the industry forward and adopt those basically de facto standards.
You touch about every point in healthcare at this point, I think.
We're trying to.
Yeah. So at our last conversation at HIMSS, which was last February, I believe, Orlando, you were talking and telling me about your relationship that you were developing with HITRUST, another third-party certification organization in healthcare. Can you give us a little update on that, and what drove you to start working with them?
So we have a great partnership with HITRUST, and what ended up happening on how that actually occurred is about 2.5 years ago, we were approached by several industry organizations who said, listen, Lee and EHNAC, we have to go through, as far as our organizations, a variety of different compliance requirements with various organizations, requirements that we're having to do. And so our internal compliance teams are having to do the same types of privacy and security provisions for each of these various either accreditations or certifications. Is there anything that EHNAC can do to help us to get some economies of scale, reduce some of the redundancy and some of our internal costs? So we spent the next 1.5 years looking at the industry, trying to evaluate the issue, getting a lot of feedback, and we decided that it was probably best because of a couple of reasons, and I'll go into in a second, but certainly the privacy and security aspect became common to a lot of these various certifications and accreditations. As we started doing mapping and assessment of our criteria that we had for privacy and security, we started looking at that in relation to HITRUST, and we found that there was a very significant amount of overlap as far as percentage between our privacy and security and that of what they do as far as their common security framework. It became clear that that was probably a good aspect for us to be able to pursue, and so we started discussions with HITRUST leadership, and what we ended up doing is saying we're going to do a couple of things. First, we made the decision to integrate and to, again, try to help the industry by adopting and saying we're going to take the privacy and security framework that HITRUST has, and we're going to basically replace our existing criteria for the same and I'll go into in a second why we did that. One was certainly for consistency and standardization, and the other was to reduce some of the redundancy. And then the second thing we did is we became an assessor for HITRUST as well for our accredited organization. So we set up an exclusive arrangement with HITRUST such that if an organization now says, listen, I want to go through my EHNAC accreditation, and then we also want to get our HITRUST CSF for privacy and security as well, we're giving reciprocal credit for an organization for privacy and security because we've incorporated the privacy and security provisions for HITRUST into ours. They have HITRUST has theirs, and so an organization, if they want to go through as well with us, their HITRUST CSF and certification, they can go through that. We will reciprocally as well credit for the privacy and security to their EHNAC accreditation for privacy and security. But that addressed a specific need in the industry, and so we, from a compliance standpoint, that has real economies of scale for organizations. It reduces the amount of redundancy, and it helps those organizations as far as their internal compliance organizations in relation to the amount of staff and resources that they need to go through, certainly at least HITRUST and EHNAC accreditation. The difference in the EHNAC accreditation from HITRUST is both have privacy and security, and they're both very close to being the same as far as what we have. HITRUST goes into a little more aspect in relation to some of the controls, the testing that they do, et cetera, and HITRUST awards CSF certification, EHNAC awards its accreditation. But EHNAC also goes into, and we've developed for each of our programs, a number of additional stakeholder-specific requirements that go beyond privacy and security. For example, for HIEs, we're looking at things like consent. We're also looking at business continuity planning, so that if an organization were to be acquired, one of these HIEs were to be acquired, we're looking for a specific plan on how the organization will look to support all of its organizations going forward, and so that there's a whole business continuity sequencing that we're looking for there. So we go above and beyond in providing these stakeholder-specific requirements. And what we do as we've developed each of these programs, we work. Most of them take about a year to develop, and we work very closely with the stakeholders in a particular industry that we're developing. So, for example, HIEs, we're working with HIEs, and we work with other policymakers as well as we develop that program to determine the stakeholder-specific requirements that we wanted to add. We've done that for each of our programs as we've continued to develop those. So going back to HITRUST, that's kind of the value proposal that we've created. We've got that exclusive relationship with them, and so offering that to all of our accredited organizations, they're seeing some real economies of scale. That's why we did it, and we're going to continue to enhance that and work closely with HITRUST in the industry to try to minimize some of the redundancy and the compliance aspects that all organizations are going through today.
If you're just joining us, this is Interviews Now, and I'm talking to Lee Barrett. He's the Executive Director of EHNAC. So that's very comprehensive. Everything that you've been talking about you're in every little part of healthcare, it seems. And are there industry mandates that drive the need for these programs, or are they chosen more for just a competitive edge or positioning?
I think what's happened, I think previously, Roberta, probably 3 to 5 years ago, I think it was more a competitive positioning, because this really comes down to assuring for any of the organizations that go through either accreditation or certification, assuring stakeholder trust to the various customers, patients that are using a particular organization's infrastructure or services. So at that point, it was probably more of competitive advantage. What's happened now, as you're well aware, and a lot of the audience is well aware, with all of the various breaches and cyber attacks that have been cyber as well as ransomware attacks, whether or not it's WannaCry or the PETA ransomware attacks, a lot of this has now heightened dramatically the need for third-party review. And the fact that now at the, not only from an audit committee perspective, but also at the C-level within organizations, the issue on how we in an organization are managing security, privacy, and their overall risk management strategy is front and center. And so organizations are now requiring and looking for third-party entities that can assist their organization in meeting and assuring that level of stakeholder trust out there. You look at this from the standpoint as well, the Cybersecurity Act of 2015 also raised a lot of awareness, and so there's been a lot of work going on. In fact, I got involved back in May of this year with the committee under Health and Human Services, their cybersecurity task group, and working with them in an effort to develop guidance to the provider community. The focus now from this task group is to provide some real significant, easy, and actionable guidance to providers, whether or not it's an individual solo practitioner, to a group practice, to a community hospital or academic medical center / health system. So, we're working on that. We're also working on a number of other aspects, I think, in the industry, as we're looking at ways in which we can create various aspects and policies, procedures, best practices that organizations can look to follow in an effort to mitigate their risk. As many of your listeners know, it's not a matter of if an organization is going to be have an attack or today. It's a matter of when, and how prepared is the organization in an effort to reduce or mitigate the extent of a breach or an incident. That's A. And B, in the event that happens, what kind of business continuity planning do they have in an effort to reduce the amount of financial impact to the organization, the amount of credibility loss with stakeholders. And so those are the types of aspects that we have continued to evolve within our framework, working as well with HITRUST, adopting the NIST, National Institute of Standards and Technology guidance and documents on cybersecurity and other guidance that they have that we're incorporating into our frameworks, which many are using as kind of best practices. So there's a lot going on in this whole realm, and certainly I'd say that we've now gone, as I said, with Equifax, we've gone from what was basically probably 1 in 3 Americans being victims of a large-scale data breach. We're probably now up to 2 out of 3 Americans have probably been exposed to a large-scale data breach. We've got HIPAA attacks as well that have gone up 300% over the past 3 years. The whole aspect of cyber attacks last year was like 63% year over year, with 93 major attacks in 2016 alone. So you just look at all of the data points that are occurring, and organizations now are saying, hey, we need third-party entities to also help us to assess our risk and identify where there may be gaps. And I think lastly is the fact that as well, a lot of organizations who are using third-party entities, contracting with vendors and other third parties, they're also in the process of looking at those third-party entities that are representing them as business associates, and as well putting some type of contractual obligations on those entities as well to be going through some type of third-party certification or accreditation in an effort to continue to mitigate some of their overall security risks. So all of this is occurring, it's evolving, and I think we're just seeing an extremely heightened awareness now as patients, customers, all of us are very concerned about how our data is used, how well it's secured. And in healthcare, we've got a variety and a number of different exchange mechanisms as we continue to increase the amount of data exchange between various organizations, whether or not it's through health information exchanges, accountable care organizations, connecting hospital to hospital, or through portals, patient portals or provider portals, various types of portal aspects in which we're making a large amounts of data available, and there's a lot of protected health information that's there. So that's how this has evolved. That's why it's evolving, and I would say that's what's helping, and I think drive some of the mandates. And there are about over 100 different cybersecurity bills in various draft states in Washington, D.C. Some of those may go forward, some may not, but it is such a large issue that people are taking very seriously. That's why we're seeing a lot of these bills being drafted in an effort to try to mitigate some of this risk for the industry. So those are, I think, some of the key reasons why organizations are driving this, and I think a lot of the organizations are looking at other aspects. And so the intent of going through these various exercises with third-party entities is to identify those gaps and continue to remediate them to minimize, I'm not going to say totally eliminate, but minimize the amount of exposure and vulnerabilities and what are called vulnerability vectors within organizations. So that's kind of the answer to your question on some of the mandates that are occurring.
Well, each one of those could be a 30-minute conversation in itself, I believe. And believe it or not, we've had our 30 minutes here. You can learn more about EHNAC at ehnac.org or follow them on Twitter at EHNAC. Thanks for being my first guest, Lee. I really appreciate you coming on.
Thanks, Roberta, and happy holidays to you and to all the audience.
We'll see you at HIMSS?
You will, absolutely.
I look forward to it. Thanks for tuning in today. For more information about Interviews Now, visit our show's program page on healthcarenowradio.com. And until next time, if it's happening in healthcare and it's now, it's on Interviews Now.